YouTube, welcome to Dr. Vibes, a learning point. This is the part 3 of the infertility series. So this is a detailed video of how you will manage a woman who is having infertility because of ovarian issues. Ovary का main काम क्या होता है? Ovulation करना, क्योंकि वहीं पे egg formation होता है. So ovulation में problem है, तो मेरे को ovulation को ही induce कराना पड़ेगा. So target is ovulation induction. So this is primarily done in 3 ways. You give letrozole, you can give clomiphene citrate, and you can give gonadotropins. Let us study about these in details. Now letrozole is an aromatase inhibitor. Aromatase का function क्या होता है? Testosterone या androgen को estrogen में convert करना. So if I am blocking this conversion of androgen to estrogen, estrogen level is low in the body. If estrogen level is low in the body, it will give negative feedback to the pituitary, causing more release of FSH. High FSH will stimulate the follicles to grow. And if the follicles grow, it will lead to ovulation. So this is letrozole aromatase inhibitor. Now coming to clomiphene citrate. This is a selective estrogen receptor modulator or SERM. So what it does, it blocks the estrogen receptors. Pituitary thinks that there is low estrogen in the body. It will start producing more FSH. More FSH means more growth of the follicles, causing ovulation. In clomiphene citrate, we have 2 options. N-clomiphene, which is more potent than ZU-clomiphene. Now, how to use this? You start this on the day 2 of the cycle. You give single dose for 5 days. Don't exceed the dose because there are many side effects related to clomiphene citrate. For example, it can cause visual disturbances, it can cause multiple pregnancy, it can cause ovarian hyperstimulation syndrome, it can cause endometrial atrophy, and if you use it long term, it can also cause cancer. WOM. Visual disturbances, ovarian hyperstimulation syndrome, multiple pregnancy, and endometrial atrophy. Maximum you can use this for 6 cycles. I told you in the cycle card second day में लेना होता है, maximum 6 cycles तक use कर सकते हो. Here the ovulation rate is 80% and the pregnancy rate is 40%. Now coming to gonadotropins. The dosage is 75 international units to 300 international units. You can use the human gonadotropins, menopausal gonadotropins. You can also use recombinant gonadotropins. You can use purified urinary gonadotropins and you can use pulsatile. बहुत सारे options है. Human use करो, pulsatile use करो, recombinant use कर सकते हो, and purified urinary gonadotropins can be used. But what are the side effects related to gonadotropins? First, it can cause epithelial ovarian cancer. It can cause ovarian hypersensitivity syndrome and it can cause multiple pregnancy. Other drugs that can be used is metformin and bromocriptine. Now come to follicular monitoring. तो फर्स्ट स्टेप आपका हुआ ओव्यूलेशन को इंड्यूस कराना है. अब ओव्यूलेशन इंड्यूस होने से क्या होता है? फॉलिकल्स ग्रो करने लगेगा, तो मेरे को फॉलिकल्स को मॉनिटर तो करना पड़ेगा ना. सो वी कम टू फॉलिकुलर मॉनिटरिंग. सो दिस इज डन ऑन द डे 8 ऑफ द menstrual cycle using a transvaginal sonography. If you see that there is 18 to 20 millimeter follicles, you can be happy that yes, ovulation अब होगा. कैसे पता चलेगा ओव्यूलेशन हो रहा है? There will be ruptured follicle and there will be minimal fluid in the pouch of Douglas and there will be triple line endometrium as well. और एक चीज कर सकते हो फॉलिकल्स को स्टिमुलेट करने के लिए, यू गिव alpha HCG because alpha HCG stimulates the luteinizing hormone and that can cause LH surge. You can also give recombinant LH in this step. So this is how you will manage a case of infertility in a woman due to ovarian causes. In next video, we will study about the tubal manifestations or the tubal problems and how to deal with those that lead to infertility in women.